Hello and warm welcome to everyone joining us today for the fourth mental health webinar of the year on the topic Modern Therapeutic Strategies for Mental Health. This insightful session is being brought to you by Ecocivilisation in association with Vohra Women and Tiraziva. I'm Dr. Rajni Vohra, founder of Vohra Women, and I'm being joined by my co-host and friend Eleftheria Kakambouras, founder of Teraziva, and my friend Gloria. In our previous three webinars, we have tackled some of the most pressing issues around mental health, like breaking the silence, addressing stigma, and understanding mental well-being. Today, we will take this conversation forward by exploring the treatment strategies and different therapeutic approaches that are helping individuals on their journey to mental wellness. To explore this issue, this crucial theme, we have with us three exceptional speakers, each bringing a unique perspective and deep expertise. And now I'm very delighted to invite my dear friend and co-host Eleftheria Kakambouras to help us ground our focus with a moment of mindfulness. Over to you, Eleftheria.
Thank you so much, Rajni, and welcome to our esteemed speakers and everybody in the audience, and also welcome to everybody that will be watching this recording in their own time. We love to start our webinars with just a moment of checking in with the self, a moment of presence. And so I will just invite us all to just for a moment, if it feels comfortable for you, closing the eyes or just focusing on a point in front of you, and just feel your feet on the ground. And just imagine or sense or feel your feet, the balls of your feet connecting to the ground. And just call back all the parts of yourself that is out there today, that maybe still has some lists of things to do, that's connected to tomorrow or yesterday. Just call those parts of yourself present into this moment. And we're just going to start with a deep belly breath in. Just draw that breath in, expanding the belly, the chest. Draw that breath to the top of your head. And then just exhale out that breath through your mouth with a big sigh. Just allowing your entire body to relax completely. And turning our gaze inwards, we just do a little mental health check-in with ourselves. How is your body feeling today? Without analyzing or needing to fix it. How is your mind feeling today? Where are your thoughts? And then just bringing your awareness to the gentle in and out of your breath. I will just offer you these beautiful words. An excerpt from a song called Radiance by Jai Uttal and Ben Leibach. Peace to the inner and outer environments. Peace to the 5 elements within and without. Peace to this body. Peace to this mind. Peace to this huge ocean of emotions and feelings. And by the power of the truth and for the happiness of all beings, may we have a culture of peace, a society of peace, a world of peace, where we can have days of peace, nights of peace, sleep with peace and dreams of peace. By the power of the truth and for the healing of all beings, may we have peace in all moments and in everything. And then we take a deep breath in, just becoming fully present in every cell, every bone, every muscle, every organ in your body. Exhaling out that breath and gently opening up the eyes. Great, thank you. And now I hand back to my colleague, Rajni.
Thank you so much, Eleftheria, for that beautiful, calming moment. In fact, you have truly aligned us with the purpose and energy of today's conversation. So, thank you once again. And it's time to welcome our first guest. So let's warmly welcome our first speaker, Dr. R. Srinivasa Murthy, a renowned psychiatrist dedicated to improving mental health. Dr. Murthy completed his MBBS and specialization in psychiatry at CMC Vellore and served on the faculty at PGIMER Chandigarh. Before joining NIMS Bangalore in 1982, he led the psychiatry department at NIMS from 1989 to 1996 and retired in 2003 after a distinguished career shaping mental health care and research in India. Post retirement, he worked with the WHO in Geneva, EMRO, and Iraq, contributing to global mental health initiatives. Sir, we are very honored to have you with us today, and over to you, Dr. Murthy.
Uh, Greetings to all the people, particularly the panel members. I'm not mentioning each of your names since I won't say it properly. But the way we started the session has been very, very special. It's been fantastic to talk about mental health, self-care, and recognition that all of us need mental health rather than only people with mental disorders. What I plan to do in the next 20 minutes or so is to focus upon what is the exciting thing that's happening in the modern therapeutic strategies for mental health. I thought with that limited time, I will choose two topics for that. One is cognitive behavior therapy. The second one is lifestyle for mental health and physical health, since that was the theme of the American Psychiatric Association last year. So it's a very important topic. But before I do that, I want to place the current situation, the journey of mental health, taking us back to 200 years back when Dorothea Linde Dix, who started number of mental hospitals, said this just to remind us how far we have come. She said, hospitals are the only places where insane persons can get better and they can be taken care of humanely and properly controlled. From there, we have come a long way in the last 200 years. After things, besides cognitive behavior therapy, which is of 50 years origin, the other major development that occurred was by Freud at the beginning of the 19th century. I'm mentioning it to connect it to CBT in a minute. I will do that. Freud's work was very important because he moved the dialogue from the bad, mad to sad. I'm playing with words in the sense that all of us are vulnerable. All of us can get better. All of us can look at our personal life, that is the childhood experiences, parenting, and other things, which is the part of psychoanalysis. And all of us can become therapists. You don't have to be a doctor to be a therapist. So this was a very big breakthrough that moved the deviancy model to the normalcy model in a big way at the beginning of the last century. All of us know about psychoanalysis. We know about the wide range of conditions they took care of and how it dominates even today, the unconscious and the conscious and other things. But unfortunately, psychoanalysis had problems. It was too oriented towards a particular culture, Jewish culture to be specific, very expensive, very elaborate, and very long-standing. So it did not persist long. In 1950s, a couple of things happened which are very important for us to talk about cognitive behavior therapy. One was closure of the hospitals, what we call it as deinstitutionalization. This was largely because of human rights. More than that, the occurrence of the discovery of psychotropic substances, which moved people from hospitals as community to community as the hospital, which was a very important thing because suddenly mentally ill people had rights, and also their progress of illness was seen from more than the psychopathology. Let me just give you two examples to illustrate that. In the 70s, Dr. Leff discovered that among the people who are schizophrenics on medicines, some people relapse, some people don't relapse, and came up with the expressed emotion, saying that the family reaction, how the family criticizes or supports, makes a difference. Later on, another 30 years later, he discovered avatar therapy, how even the severe symptoms, 30, 40-year-old symptoms like hallucinations, can be controlled by the individual themselves, which when I did my psychiatry would have been blasphemy if someone talked about it. So we have come a long way from institutionalizing, deinstitutionalizing, and recognizing the power of the individuals to make a difference to their own mental health. That's where we come to the cognitive behavior therapy. Now, this is a really, really remarkable development by R.N.T. Beck. For example, when I did my psychiatry in 1972, the only thing we know about R.N.T. Beck was Beck Depressive Inventory to assess depression. You know, at that time, cognitive behavior therapy was not there. Even the Bulc's work of learning theories and behavior therapy was just beginning at that time. But what Dr. Beck did is remarkable. I want to pay my tribute to him. He just passed away about 4 years back in 2021 at the age of 100 years. What he did was, he said, I want to reconsider the whole of psychiatry as symptom-oriented to thinking-oriented. Just allow it to sink into your mind. All the whole of psychiatry, from the bad, mad, sad, was all symptom-oriented. He said it is not the symptom which is important. It is the individual, the way he or she will think about it, react to it, which decides what will happen. Based on this, he built up a whole theory and threw away in the sense, put aside the unconscious mind, influencing thoughts and behavior, to saying that the way you perceive your thoughts, the way you perceive your emotions, the way you imagine the situation will decide the behavior that you do and the way you recover from the same thing. And to quote one or two things, and in point of fact, Dr. Martin Seligman says that Dr. Beck is the most important psychiatrist of the second half of the 20th century. That's real great appreciation for someone from positive psychology. Coming back to, in other words, Beck said, took something that most people think as the symptom and said it is actually the cause and we must address that rather than the symptom. What did he say further? We can work on challenging and changing the way we interpret thoughts. Doing that greatly reduces human suffering. Now, he didn't only say it, but he said this is practicable. It is not philosophy alone, it is practicable. And how do we do that? Dysfunctional thinking, which influences the client's mood and behavior, is the common factor. By learning to evaluate their thinking in a more realistic, adaptive way, they can experience a decrease in negative emotion and maladaptive behavior. Now, just see the real big shift that he made, that here is the person coming with a problem and saying that, look, you are not the problem. Your problem is not the problem. Your thinking is the problem. Then, of course, he went on to look at emotions, look at beliefs, imagery, and behavior. Now, in the therapy, another very important thing he did, he said the client is a collaborator in the therapy. Unlike in the Dorothea Linde Dix, he was thought to be violent, he should need to be controlled. In Freudian case, it was the therapist was sitting in the chair and the patient was on the bed, although he's surrendering to the therapist. Here, Beck said, you are the collaborator. The goal is growth, and much more than that, once you learn how to grow, you can generalize this for the rest of your life. Now, let's get to the nitty-gritty of the cognitive behavior therapy. What does the cognitive behavior therapist do? I will give you only the principle, not the examples of a practice. One is that to conceptualize the care in cognitive terms, not in symptom terms, not in behavior terms. Secondly, recognition of the thinking, emotions, and behavior, how they are connected to each other. You know, why are you feeling sad? Why are you feeling depressed? Why are you feeling angry? Because you are thinking that your situation is bad is the cause. Thirdly, bring about changes in the thinking, emotions, imagery, and then bring about changes in the behavior. Lastly, all of this would lead to new ways of looking at the situation, learning from one's own personal feelings, and developing a capacity to bring about changes. Usually, as all of us know, the sessions are usually 8 to 12 sessions, each session lasting about 45 to 60 minutes, with lots of homework for each person between sessions. You might say, how does this really work out in practice? As I said again, it is a collaborative in nature. There is a therapeutic elements between the doctor and the therapist and the client. There is education is the most important thing, and developing action plans appropriate to the person in his or her life situation is the core of it. All of this leading to a new person coming out of it, feeling more competent, more capable, and better control of his thinking, emotions, and imagery. Now, you would all be knowing that this was the core of the work that has been done. And Judith, who is his daughter, who runs the Beck Institute, is continuing the tradition, and it is widely there. And more than about 2,000 research publications have come from the time the first publication came in 1977. As it happens with our discipline, number of variants have come up. Some of them are, I'll read it out: rational, emotive, behavior therapy, problem-solving therapy, acceptance, commitment therapy, exposure therapy, cognitive processing therapy, mindfulness, cognitive behavior therapy. And one very important new development that has occurred, two developments. One is the internet-based, other one is what is called as culturally relevant cognitive behavior therapy. The first one to do this work was by Duke University, Koenig, and others, who developed a RCBT, religious-based cognitive behavior therapy, for treatment of depression in chronic medical illnesses, using the principles of all the major religions as the resource to be able to base the interventions, thoughts, and other things on the person, client's beliefs, practical situation, and resources. And this has been done in a number of situations. One other person who has done a lot of work in this area is Farooq Naeem from Canada, who has worked with the Pakistan Islamic group and produced a lot of resources. So we have moved from a universal idea to a situation-specific and resource-specific to the particular situation. The other major development that is occurring in the last 10 years is the use of internet as the resource for this cognitive behavior therapy. Since the work is done by the client mainly more than the therapist, it looks very attractive to think of internet-based and all the other resource-based method. One of them, which was developed in Bangalore about 8 years back by Dr. Seema Mehrotra, is called PUSH-D. PUSH-D stands for Practice and Use self-help for depression. This is a totally internet-based, self-generated program, and it has been tried it out, and it has been found to be useful, except that the person has to be very sophisticated in his or her ability to use the thing in the internet. But interestingly, just about 2 years back, one of our students, Sindhuja Sudarshan, used this method in a hybrid model, in the sense that 4 to 5 sessions are face-to-face, another 4 to 5 sessions are using the internet model. And this has been found to be useful, and the doctorate has been done, and I've talked to her, and she says it's very acceptable to the people. One other variation that has occurred in Bangalore is, the number of research has been occurred, but time doesn't allow me to talk about all of them, was that to compare the acceptance commitment therapy and cognitive behavior therapy in depression by Saima Jamil. This also has been found to be very useful, acceptable, and practicable. So we have really a lot of things going for cognitive behavior therapy. Immediately you will say, Dr. Murthy, is it all honey and sweet? No, there are some issues that come up when you want to use it. First and foremost is that most of our clients in a developing country come expecting the therapist to do the work, not the person to be doing the work. That is the passive nature of the client is a barrier to start off. When you say that, look, we are going to work together, the person says, my God, I thought you were going to give me a medicine, or you're going to solve the problem for me. The second one is there is a certain degree of educational background that is necessary for cognitive behavioral therapy, particularly the internet-based therapy, to be practicable. And we need, as I mentioned it, we need to tailor it to the local culture of the person rather than think of it as an international one. Even the term that we use it has to be different. Then we have to, from the beginning, teach the person, the client, that he or she is the active person, and homework is an important part of it, and involving family members sometimes is useful, and the therapist has to know a lot more. For example, if I'm a Hindu, I need to know about Christianity, Islam, Jainism, Judaism. I can't just say that I will talk about my Hindu values to a Islamic patient or something like that. So we need to know the cultural resources and try to cleverly, I'll tell you an example of how this occurred. For example, I was dealing with a young, about 40-year-old lady who had severe grief because she had not been able to give her kidney to a brother who needed it, and he died. And she couldn't forgive that she has killed her brother. And everything I did didn't work, till I told her the story of Buddha, where an elderly lady comes with her dead son, Kisa Gautami, and Buddha, instead of saying that I can't give life to him, he says, please go to the village, every house, and ask if there is no death, and get mustard from them, then I will cure you. I'll get your son, bring him back to life. And she goes around and finds that every house has death, and she realizes cognitively that death is an inevitable part of it, and she becomes his disciple, and that's the story. So what I could not achieve with all my professional thing, I was able to do it with this simple story, because that story had a cultural meaning to the person, and it conveyed 10 times more than what I was communicating. I can tell you more stories of that type, but if time are in the discussion. Now, so I would like to say that it is a fantastic development that has occurred. Not only it has empowered non-medical, I'm a medical person, so I can say it very easily, non-medical people to be therapists. Much more than that, soon we will reach a point where even ordinary individuals, without going to a client, will be able to help themselves to become better in terms of their mental health. Two other advantages are there. One is the reducing stigma. One of the biggest problems in mental health all over the world is stigma. I don't want to, I mean, you are seeing the story of Biden's possible mental illness in the original Sil book or other things. We are burdened with the idea of not wanting to seek help because it is associated with the stigma, negative things, while cognitive behavior therapy brings in a positive approach to the things. Similar to lifestyle, I'm going to come to that in a minute. The other one is very important to me. It talks about mental health, not mental illness. And it talks about population, not patients. These are big things in a world where mental health care is very, very limited all over the world. Now, I want to spend a few next 5 minutes on talking about lifestyle psychiatry. This is equally important. This is an emerging area for modern therapeutic one. The reason is that we have now recognized, particularly after the COVID-19, that all of us are vulnerable and all of us are capable of becoming strong mentally. This was reflected in the American Psychiatric Association last year. Dr. Vishwanathan, who was the president, chose this as the theme for the last 1 year, that is lifestyle, mental health, and for mental health and physical health, and lots of articles have come out. Essentially, what it means is that there are behaviours supporting mental health, and this can be used for prevention and treatment. What are these? Physical exercise, sleep, diet and nutrition, mindfulness-based interventions, social correction, social connectedness, spirituality. Each one of them has enormous evidence. Let me just read about the evidence for exercise. A few of the statements in the last few months. Lifestyle-based interventions are recommended as a functional component of mental health care. Exercise is effective for treating mild, moderate depression. Exercise remains underutilized. Exercise therapy is associated with reduced depression, anxiety in older adults with cancer, and so on and so on. And we can go on talking about it, any amount of it, in terms of the value of lifestyle psychiatry. So my own feeling is that we are going to, like cognitive behavior therapy came and empowered the person with the problems, saying that you are not the problem, your symptoms are not the problem, your thinking is the area where you can improve and become stronger. I want to close by saying that I have used this method in a self-care guide for caregivers of special children. What happened was, when we offered mental health care to them, they said, I'm not interested in it. I am interested in looking after my special child. We converted the self-care into saying that if you do this, you will live 10 years longer. All of this, the exercise, sleep, nutrition, meditation, all of these are, and what we did was we converted them into pictures and made it very, very practical. And we have put it into practice, and it works, and people find it more acceptable than going to a psychiatrist, and they can handle it themselves. I come to the end of my presentation by saying that we have moved from bad, putting them in jail, to mad, putting them in asylums, to sad, taking them for therapy, to saying that mental health is relevant to each one of us. Each one of us is capable by our own resources to be mentally healthy, and if we become ill, to recover from it with our own efforts. I think this is a fantastic breakthrough in the thinking of the mental health area. I would end up this one saying that there will be more innovations in this area, and I congratulate I congratulate all of you for this special session, and I'm looking forward to listen to the Ayurveda as well as music therapy as tools or resources for mental health. Thank you very much.
Gratitude, Dr. Murthy, for giving us historical perspectives along with some interesting, intriguing anecdotes, narratives from the history, mythology, and from real life, of the journey of the discipline of psychiatry, and insightfully, brilliantly articulated presentation. Thank you so much for that, sir. And I also request you to please mention the name of the book that you have just showed us. Okay. And also let our viewers know where this book can be found. So
this can be, this book, I will put my email. If you send it to me, it is freely available, and I will send it by electronically, both in English and local language Kannada, and this is available. And any other resources which I have referred to, I can provide that if people send me an email. Okay.
Okay.
I'll put it in the chat box.
Yes,
I'll put it in the chat
please
box.
mention in the chat box.
Chat box. I'll do that.
Yeah, and I have a question for you, and that stems from my observation in the families of the friends and society at large. I have seen one of the biggest challenges that families often face when their loved ones go through this painful situation, and especially that is medication, because not every medicine can be given intravenously or in injectable form.
Yeah.
So and majority of the time, you know, that there is a challenge from patient's part, that families also give up, that patient doesn't want to take the medicine, what to do? So in your day-to-day practice, I'm sure you must have encountered endless cases of such challenge. How do you typically address it, and what would be your advice to the families who are going through this challenge?
I think it's a universal problem in terms of the person feeling that I am not ill, or I don't need medicines, or it produces side effects like sleepiness, putting on weight, slowness and other things. The way I say it, luckily for us in India, this problem is much less than in the West because the family is there. 99% of the people in India are staying with the family. What I find is that if the family can understand and make it a collaborative effort with the patient, rather than, for example, I tell them saying that instead of saying that go for a walk, say, let's go for a walk. Let's go to the temple. Let's go to the mosque. Let's go to the church. Or let's go to the market together. Something similar to that, we'll have to develop it for the medicines. The other thing that is not happening adequately, Rajni, is that not many of us psychiatrists are treating the person as capable of understanding, and making the person a partner and see the medicine taking as beneficial. So the answer that I'm giving is, one is teach the family to make it into a part of the routine, taking the medicine also. Secondly, work with the person, allow the person, like we do it in cognitive behavior therapy, allow not the symptom but the thought. What will this medicine do? For example, I am a diabetic, I take medicines every day. I don't complain about it. Unfortunately, again, as I said, the stigma is what makes the person feel that, you are making me mad, you are calling me mad. What I do is that, look, you are not mad. This medicine is required, similar to a person with diabetes or hypertension or asthma. And I get into that. And most important technique I use, Rajni, is to see the patient alone and have a dialogue with them. Otherwise, most of the time we do it with the family being there, then he cannot respect certain things we cannot do. The minute you allow the person saying that I recognize your personhood, I recognize your autonomy, I recognize your feelings, and set up that, rather than saying that I'll see you after 1 month or 2 months, come 1 week. Or now that we have phones, talk to me on the phone when you get upset. So you make it again, use the CBT techniques for that. But there are some people where it is a difficulty. I agree with you on that. Thank you very much.
Thank you so much for this precious advice, because I'm sure that there are many families who are facing this challenge would find this advice very beneficial. And we have another question for you in the comment box from Sebastian Nor. That is, does this mean that the underlying cause, which is not the root cause of the symptom, is what needs healing? And that this is healed by changing one's mindset, as you were discussing during your presentation about it's all in your mind. Yeah. So adopting a growth mindset instead of a set mindset, it's a rhetorical question, actually.
Yeah. No, I think there are, I forgot to mention one thing. There are certain conditions like personality disorders, person living in a very stressful, multi-stress situation, CBT will not help because the thing is so overwhelming. Similarly, if the person is actively psychotic, at that point, it's not enough. But when the person recovers, it's helpful. But to a large extent, particularly if we start very early in the illness, it works very well. Only when it becomes chronic, what we used to call it as chronic, long-standing, then it becomes as. But in avatar therapy, again, they have shown that even the 30, 40-year-old auditory hallucination can be controlled if you have enough patience, enough work to do the person.
Thank you so much,
Thank you.
sir. I'm sure this would be source of strength for many who are watching it and who would be watching the, this session is being recorded. So I'm sure this is going to be very beneficial conversations. And you have already given us assurance that you would be with us
I'm
throughout the
just going to
session.
put my
Yeah,
I'm
yeah,
just
yeah.
putting my ears.
So thank you so much because
Yeah,
we are
thank you.
about to welcome our
Yeah.
next speaker. Eleftheria, do we have any other question for Dr. Murthy? Okay, thank you. So our next speaker is Dr. Ashish M. Gaikwad, MD Ayurveda, a respected Nadi Vaidya and expert in pulse diagnosis, Panchkarma, and holistic treatment of chronic and lifestyle disorders. He is the managing director of Kankaveda Healthcare and Wellness Private Limited, CEO of Kankaveda, and founder chairman of Three Ports International Chamber of Commerce. With over 20 years of clinical and teaching experience across India and the UAE, he integrates Ayurveda, detox therapies, counseling, and cosmetic treatments for holistic healing. The floor is all yours, Dr. Ashish.
Thank you. I just want to share the slide. I hope you can see this. Is visible?
Yes, it's visible, sir. Yeah, now it's full screen.
Yep. Namaste, everyone. It is honor to be here today as I share insights on the subject that beautifully bridge ancient wisdom and the modern science. That's our ancient Ayurvedic therapeutic tools to boost your mental health. We are living in a time where anxiety, depression, stress-related disorders, and cognitive decline are affecting people across all age groups, not your, mine, or above 35, but everyone, just like the kid who is going in a first standard also, because he is also have anxiety. But that if the answer to better mental realize license or emotional stability and cognitive clarity lie in tools developed thousands of years ago, which is in Ayurveda. As a practitioner of the Ayurveda and student of the modern neuroscience, I believe that ancient tools like the meditation, yoga, nootropics, that's Ayurvedic nootropics also, and the Ayurvedic therapies are not just relevant today, they are essential in combating our growing mental health crisis. Let us explore the 5 powerful Ayurvedic tools that enhance mental health and are now being validated by the modern neuroscience also. It's a backing to, you can see it's a backing by the neuroscience, because there are a lot of researches are going on. In the word, when we say research, that means something is searched and now we are researching it. So everything is there, now we are researching it. So first topic, which will be, is it my slide? I'm not able to see the slide is, the second slide is there, Dr. Rajni?
No, second slide, we still see the first slide.
Oh, oh. So is it okay if there is no slides then? Because I think
Absolutely
there is
fine.
some
As long as you are fine,
glitches.
it's absolutely fine. If you can explain it without slides.
Yeah, we are just going to discuss about the 4 things, and we are discussing about the how the tools we are going to use for our patients and for the well-being of our society. So meditation, everybody know the meditation. That's a, a training to a mind. We can say rewiring the brain. In Ayurveda, it is known as the dhyan. uh, Everybody must know about this word dhyan. That is the Gautam Buddha's position, which is the dhyana mudra, or we can say the meditation. It's a fundamental. You can say the a meditation is the foundational mental hygiene practice, and which is called as a dhyan. Thousands of years ago, our seers prescribe it is to be stabilize the manas, that is a mind. Manas is a Sanskrit word for the mind, and connect with inner self. Now these are the very heavy words for I think other people, but most of the people are working with a mind, so these are the very common things, and so many words we are um, used to, because we are hearing every time with the yoga. When yoga is very famous nowadays in a western side also. So today neuroscience confirm these benefits through a concept called neuroplasticity. So this word is very famous. And what is a neuroplasticity? The brain's ability to rewire itself based on the experience. Now, the functional MRI studies showed that the regular meditation enhanced the prefrontal context that is associated with the exclusive functions like the focus, planning, and emotion regulations, and reduces the size of the amygdala, which governs governs our fear and stress response. A 2011, that is the Harvard study by the Sarah Lizar, demonstrated that just 8 weeks of the mindfulness meditation could increase the cortical thickness, which is very important thing. That is, cortical thickness is observed to be increased in the hippocampus and the responsible for the learning and the memory. Now, in Ayurvedic terms, if we've seen the balance, which is the sadhak pitta. Now, these are the Sanskrit words what I'm using. Afterward I will give you the this slides so that we can share with the other people also. And the tarpak kapha. Now the tarpak kapha and the sadak pitta, these all are specifically the emotions and the nourishing the nervous system. And basically these both we can see when according to the Ayurveda at the positioning of the heart. So when we are saying the manas, man, and we are saying the brain, at the same time these both the things can be visualized or can consider in the both the places, in the brain as well as in the heart. Now the second point is the yoga. This is the second tool, yoga and pranayam. So basically yoga is the, you can say the misleading of the word, or you can say this is a basic word is a yog means that is a joint of inner soul to the outer soul, that is the inner pran to the outer pran is the breathing. So alignment of the body, breathe and brain is the basic concept when we are saying the yoga and a pranayam. Yoga is just a physical exercise. It is a neurological reset. When we can neuro physiological reset when says, then asana combined with the pranayam, it's a controlled breathing. It's a directly influence to autonomic nervous system, shifted to the balance from the fight symptomatic mode to the calming the parasympathetic mode. Research shows that alternate nostrils breathing, which is called as a nadi shodhan, and Brahmari pranayam can reduce the cortisol level, increases the GABA, which is the gamma aminobutyric acid, and improves the connectivity between the insula and the prefrontal cortex, enhancing interconceptions, that is self-awareness and mood regulations. So basically, if we can do handle without medicines all these things, then it is a beneficial for everyone. And kids also can, if we guide the kids properly, the people, the patients who are kids or well educated also, who are want to avoid the medicines, they can utilize such a type of therapies at least for the 30 days, and they can see the results, how they are feel and how the correction is there. From the Ayurvedic perspective, if you see, this harmonies is a vata dosh, calms nervous system and supports the pranavat, which governs with the mental activities according to the Ayurveda. Now, the third most important is the Ayurvedic nootropics. The plants which is used for the brain's health is called nootropics. Just like the Brahmi, Ashwagandha, curcumin, that's a turmeric. Long before the term nootropics entered the modern lexicon, and Ayurveda had already developed the system called Medhya Rasayan. So we customize the Medhya Rasayan. Actually, in our manufacturing unit also, Medhya Rasayan is specifically we created for the gurus comes from the Australia. The Australian monks who comes for the meditations for the 3 months in a Ganeshpuri area near the Mumbai, and we are creating this Medhya Rasayan according to their pulse, so that they took these medicines repeatedly they are taking before the pranayam. So this is a detox procedures is going on, and they made their rasayan is giving the boost to their brain. They are herbs. They enhance the intellect, memory, and emotional stability. Now, few Ayurvedic nootropics which supports the modern research, which is the Bacopa Manori, which is the Brahmi, known as the memory booster, is it is the modulate leaves of neurotransmitter, or you can say like the contents are the acetylcholine and the supports the uh, synaptogenesis, as well as the clinical trials have shows the improvement in the memory, attentions, and the anxiety reductions. Ashwagandha is also, which is a Withania somnifera, which is also giving the very good results in the chronic stress and anxiety. And it's confirmed that uh, the randomized controlled trials, when it happens, at that times it shows that this adaptogen reduces cortisol, supports neurogenesis, and protects against the neurodegenerations. So these are the backed by the modern science. Now the curcumin, everyone know the benefits of the curcumin. This is the powerful anti-inflammatory and antioxidant. It crosses the blood-brain barrier and modulate the BDNF, which is the brain-derived neurotrophic factor, which improves the moods and protecting the against the depression. So collectively, what Ayurveda says, it supports to ojas. Now this is the different word. Ojas. Ojas is the purest form of the um, Saptadhatu. Now Saptadhatu is a definition. I have to give the full definition. That is, each whatever we eat, everything is converted to to another dhatu. Dhatu, the definition of the dhatu is whatever is dharayati, it is dhatu. Whatever we are made up of is each element is called as a dhatu, and there are the seven dhatus, and this is the ashtam dhatu, which is the purest form. And the who have the ojas is the best one. They are very mindful, they are very intellectual, they are very um, having the very good aura, such type of qualities they have. Now the fourth one, tools, which is in Ayurveda specifically we utilize, is the Shirodhara, which is a healing the mind through the forehead. Now, how it we perform? We use the this is one of the therapy which continuously we pouring the medicated oil or the decoctions, particularly on the Ajna chakra, which is the third eye, which is called as the third eye center eye, which is on a forehead, and from the we can say from a neurological perspective, we've seen this is representative of a rhythmic stimulation which activate the parasympathetic nervous system, shows down EEG brain waves to alpha and theta states. The same seen in deep relaxation as well as the early sleep, and reduces the sympathetic overdrive. Studies using the EEG and the HRV, that's a heart rate variability, have demonstrated that the Shirodhara reduces the anxiety, promotes the deep sleep, and may help with the insomnia and hypertension also. Ayurveda believes that it's a Vata dosha and nourishes the Majja Dhatu. Again, these are the Sanskrit terms, and Majja Dhatu is the one of the dhatu which is in a, we can say, the bone marrow. It's a Majja Dhatu. The brain and the nervous system, the revitalization of the mind body axis. The last one tool, what I have to suggest is a Marma Chikitsa. Now, this is the tool we can utilize for our patients very easily, or you can suggest advice to anyone who have the anxiety, who have the issues, just like Dr. Murthy was telling about the hmm, there is a nuclear families, and because of the nuclear families there is no back support. Otherwise, in Indian families in earlier stage, or nowadays we are also nuclear in converting into nuclear families, but the combined families was there are so many people are in the families and who are the supportive. If so many people are around you, or you're attached with a number of people, then that anxiety things comes down automatically, because you having the every time your attention is grabbing by someone else, or you are getting someone's attention. So this one Marma Chikitsa, which is a activity which is neural gateways, you can say. That's a why I'm saying that's activating the neural gateways, because Marma Chikitsa is the particularly the Ayurvedic system stimulating vital points, and it is a correspondent to nerve endings, joints, and pressure points. So in our body, there are the 107 Marma points. And what exactly the Marma points are there? Marma points are at the end of the nervous system, and where is the pranavayu is there. So these are the vital points, we can say. And there is a gentle pressure or stimulation of the specific marmas, specifically though those are the head, neck, spine, can release the blockages of the energy and giving and relieve from the emotional stress. Basically, if any of the patient who is having a lot of stress, anxiety because of their past life, not I'm saying the past in between their childhood memories, or maybe in a adulthood memories, but there are the memories which considered as a past life, which is a bad past life. So how we have to nullify that? So you can see my palm, it's a left, my left hand, and here in between the thumb and first finger, index finger, there is a one point. And if I'm pressing this one, so if there are the blocks in my mind, there are the old memories are there. If I press this one, I have a pain. If there is a no blocks, there is a no pain. So this is called as a delete point. So anybody can do this. If anybody have their bad memories, they have to remove it. How they are going to remove it? After having your dinner, relax, sit in front of the mirror, press this point 6 into 6 time. That's 6 time. There is a one pause, then again 6 time. This 6 into 6 time you have to do, and then after you have to just hold this hand like this and remember that situation which is hurting you, but not involving in that situation, but see that situation as a third person, and just calm yourself, relax yourself, and just if you are hurt that time, you just say, okay, I'm going to forgive that person. That is the situation of the time. That is that situation. That's a bad situation. Nobody is guilty for that. And I'm going to forgive the person, and I'm going to delete that moment from my mind. See how you can sleep at that night. And take my word that that thing will be automatically delete from your brain. And ultimately, what my experience when I'm doing these therapies with a lot of patients, then ultimately whatever medicines, a small dose of Ayurvedic medicine I'm giving, that's 100% working because that block is removed. And this is the magic of the Marma Chikitsa. So specifically, this is the acupressure point, but these are the neurovascular bundles and the acupressure point together, and this called as the Marma, or you can say this is the vital point. Scientifically, studies indicate the Marma therapy may improve the vagal tone, enhance relaxation, and regulate brain heart coherence. In essence, it awake the dormant neurological circuits, allow prana to flow freely. So these are the few things. So basically, conclusion of my speech is that returning on the ancient and modern science when we are reuniting these two things. So meditation, yoga, herbal nootropics, shirodhara, and marma therapy are the best five things which you can utilize, and four of them you can utilize every day, and within 30 days you can see how you are recovering or your patient is recovering. Thank you very much for giving me this honor. Thank you everyone that you are listening me so uh, quietly. And please, if you have any questions, you can go for it.
Thank you so much, Dr. Ashish. We are very grateful for your expertise and advice and some of the very pragmatic techniques that you have taught us during the session. And thank you so much for such an elaborate, stupendous presentation. So, Dr. Ashish, I want to tell you that I have been an ardent follower of Ayurveda, yoga, and Panchkarma. I have been following yoga for many, many years. And
Wow.
needless to say that I have seen immense benefits within myself, not just physically, but also at the soul level too. So definitely, I have gained a lot of from yoga and Ayurveda. I want to just ask you, on an average, what is the duration of these therapies? Because majority of the decoction can be taken for the duration of 3 to 4 months, if I'm not wrong. Yeah, can you please
Correct.
clarify? Yeah.
Yes, any of the decoction, if you are taking, that is not more than 3 months. And basically, what we do for everybody, it is not possible to visit doctors every time. So we teach the patient that what decoctions they have to take, how they have to take, how to cook they have in a
Mm,
kitchen, and that type of decoctions, if they are taking a fresh decoctions, then it is a more beneficial. But simultaneously, it's a 3 months decoctions. If they are having, they have to shift to the another decoction, or they have to take a gap of at least 1 month for that decoctions. Otherwise it will be resist, as well as it will anything whatever you are eating is a medicine, and medicines have the side effect if you in a long term you are taking. So
mm,
whatever you are taking, that is a medicine. And whatever, if you are having the two breaths extra than your capacity, you know that your stomach is upset.
mm.
The same role
So,
happened with the medicine also. After the
right.
3 months, you should not. You have to take a break for at least 1 month.
Okay, so I want to also understand because in majority of the Indian households, and now I see in Western world also, I have seen that people have started using turmeric a lot in their day-to-day cooking. But there is also one contradicting fact that one should not be taking medicine regularly if that turmeric is being used as a medicine. So, do you agree the practice that we Indians household have to put turmeric every day, to put jeera every day, to put spices every day in the food that we cook? Is it the right practice?
See, this is the factor of how your DNA match with the things. So according to your culture and according to your geographical situation, the herbs which are there you can utilize to digest the things. Just like if you go to the China, there is every time they are having a liquid which is a digestive for them, and they can eat the noodles every time. But if every anybody else who is from the India eating the noodles every time, they have the gastritis issue. So basically same thing, turmeric can utilize. It have a very good benefits, but not in a huge amount by the other people who are not habitual to that. Just like
Right,
the staple food. That's why we are utilizing the word staple food. If
right,
we move from one country to another country, there is just like the jet lag, there is the constipation.
right.
So to avoid this thing, we the one most important home remedy what we suggested to everyone, that a teaspoon of the castor oil and 2 pinch of the ginger powder, dry ginger powder. If you are having with a glass of water, your jet lag is also removed and your constipation is also gone.
Huh.
So,
But the problem is you cannot carry castor oil with you while traveling internationally. You
but
have to
everywhere you
find
can
castor
get.
oil in a different country. Yeah, which
Yes,
is
you can
again
get
a challenge.
everywhere. Yes,
Yeah,
yes, you can get the castor oil everywhere because castor oil is the only one oil which is not absorbed in your stomach. It
right.
is just work as a lubricant. Yes.
Thank you. Thank you. Thank you so much for your advice, sir. And we request you to stay with us because we are coming up with one more presentation. As it's time to invite our third speaker, last but not the least, Katarina Habe, Associate Professor of Psychology at the Academy of Music, University of Ljubljana. Her scientific and professional work focuses on the psychological well being of musicians, the factors contributing to the performance excellence, and the impact of music on holistic well being, including cognitive, emotional, social, and spiritual dimensions. For many years, she has also led workshops on overcoming stage fright. And Katrina views her mission as spreading scientific research findings on the therapeutic effects of music to the broader audience. As a psychologist and musician, she bridges analytical depth with intuitive creativity. For many years, she has also led workshops on overcoming stage fright, as I have already said. So, over to you, Katrina.
Hello to you all. It's my great privilege to be here with you all with such esteemed panelists. So thank you. I got very inspired by both talks. I'm gonna come from a little bit different perspective, from musical perspective, and hopefully my PowerPoint point will work. Let us see if it's working. Just let me know.
We can see that. Thank you. We can see that.
Just if I skip to the other one, do you see the second one now or not?
Yes, yes, yes,
Okay,
really.
thank God. It's working. So, my problem will be how to get everything I want to share with you in such a short time, in 15, 20 minutes. It's like, wow. Okay, I'm gonna do my best. And I'm gonna start with a quote of Nikola Tesla. If you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. And I think we're coming to time when we're gonna actually go back to our past, because I do think that our future needs healing with the energy, with frequencies, with vibration, with music actually. Music actually touches us deeply, and it touches us on every level. And if we feel music vibrations, we can feel it with the whole of our body. And when we are in a sound environment, we are actually touched by sound, by music, outside to inside, and this what surrounds us actually affects how we're gonna feel, and how we're gonna feel, it's gonna affect how we're gonna act outside. So music and sound gives us connection to our inner world and outer world. It's like a bridge between inner and outer world. I do not know if you ever wondered where does the word persona, personality comes from. There was one moment that it popped into my mind that persuonare actually means to sound. Persona means that we are in complete resonance when we are aligned in our personality. So it's so important that we tune ourselves with the sound and music that surrounds us. And it does matter in what kind of sound environment we are. Because if we are in a supportive, harmonious musical sound environment, then we feel good. And if we are in a sound environment when there is a lot of distracting factors, disharmony, that affects us also. And how important it is to be tuned with music. It can still be seen in some African tribes where everyone who is born actually gets individual healing song. And when you are not aligned with yourself, the whole community is singing this song that you were given at your birth to get yourself into the harmony again. So, music is something that is a constant, psychological constant of man through time and space. And here on the left side, you can see flute, Neanderthal flute from Habe, and this was actually found in Slovenia. That's why I put it in here. And modern science just confirms the findings of ancient civilizations because already ancient civilizations were totally aware of the effects of music and sounds that surround us. Ancient Egyptians and ancient Chinese were aware that the music on Earth, on planet Earth, is actually a reflection of cosmic rules that are in the universe. So it's so important what kind of music we put into this world because this actually affects not just our mental health, it affects our holistic health, physical and mental. How does music affect us, and what kind of effects does it have on the brain? I like this photo, this picture, because you can see what happens in our brain when we're just listening to music. Here on the right side, we can see the brain's reaction to music. And actually, our brain looks like a Christmas tree because so many regions of our brain are activated when we're listening music. We can ask ourselves, why does music have such a transformational power? And the reason we can find in three types of answers. One reason is evolutionary reasons. Music is universal ability embedded in human genome, which means that each one of us has an inborn capacities for music making, for musical abilities. And if we go back to our coming to the planet Earth, why was music sent to us? What we could do with music? Music was sent to us as a tool of connecting to each other, to communicating with each other, and to healing as a healing tool. And then we can go to the other reason, to developmental reason. we can see that music in language is the first means of communicating the emotions of the baby. And there was one scholar from Australia, and she explored that babies crying has different types of sound patterns that express baby's needs. And primary caregivers of a baby, they know what sound of a cry means and what a baby wants to communicate to us, what he needs. And music in language as means of a child, it's actually a tool of harmonization with the external world. So baby is regulating his emotions with the sound, with intonation and with rhythm in their nonverbal communication. And there are also psychological reasons why music has such an transformational power. And these psychological reasons are that musical activities such as listening, singing, acting, and composing are the best brain fitness. And as I already said, music has many beneficial effects of learning transfer on all the levels, on cognitive, on physical, on emotional and on social level. So, as I already mentioned, holistic effects of music can be seen on 4 different levels. On physiological levels, music can affect heart rate, depth of breathing, hormone secretion, muscle tension, etc. On emotional level, music is a tool for emotional regulation, for mood regulation, for increasing our self-esteem and to forming our identity. On cognitive level, music can be a source for increasing our concentration, attention, memory, spatial and temporal reasoning. And it was also confirmed that musical intelligence is closely connected to different intelligences such as spatial intelligence, mathematical intelligence, verbal intelligence. So it's all interconnected. But not the least, it's the level of the soul. Music brings a source of beauty to our human world, and it can increase our mindfulness, our flow, and our self-actualization. So, when we can start using these effects of music? These effects work actually from conception to death. It was confirmed that these effects can be seen already in prenatal stage. And here on the right side, we can see this old lady. And in old people, music can be like an anchor to their memories from this life. Now I would like to make a stroll how music can help us through our whole lifespan. So if we start with the childhood, musical activities can be used as promoters of holistic development. In adolescence, musical activities can be used as means of emotional self-regulation and as a source of building one's own identity. If we go further to adulthood, Music can be used as a means of coping with stress, anxiety, and depression. And in old age, music can be used as a means of alleviating the effects of aging, such as dementia, Parkinson's disease, or depression. But on the other hand, music is also a means of connecting with others. Today, I'm not talking about music therapy because this is just one part of music interventions that we can use to increase health and well-being. We can talk about different types of music interventions. We can talk about musicking. That means this is a type of intervention when we are singing together, playing together, for example, like in drum circles. That then the other music intervention is learning musical instrument or learning singing. And when we're learning musical instrument or singing, this holds many beneficial learning transfer effects on psychomotor, cognitive, and social emotional level. Another type of music intervention that is many times many people do not know the difference between sound wellness or music therapy, and I would like to make a distinction here because sound wellness actually is based on healing with frequencies, and it uses like gongs or Tibetan bowls, crystal harp, and other instruments to primarily affect our body and through our body change emotional responses in body, cognitive responses in body. But you come to this therapeutic effects through healing with frequencies. Music therapy is clinically an evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. And I have to say that in Slovenia, we have Institute Knoll for music therapy and supervision now for already 10 years. And our music therapists are working in different social settings. Let's say they're working like in pediatric clinic, at oncology clinic. They're working in different others institutions. So they're becoming more and more included in our society. And now I would like to talk about different interesting research projects which are quite applied at our university. We had an interesting project, music therapy with children with emotional behavioral difficulties. We did this project with music therapists, and we also released a book. It's like a handbook for different professions who are working with children who have emotional behavioral difficulties, and the book is called Regulating Emotions and Behavior with Music. And there you can find different didactical tools how to use music to regulate emotions and behaviors in children who have difficulties on this level. Then we had interesting project, Music and Autism, which was then also formed in project Musical Ocean, where we promoted inclusive concerts. The other project that we are working on currently, it's a project promoting health and well-being with music in vulnerable groups. The last project that we're working on right now is the project The Role of Music in Pediatric Clinic. And we also had we had one symposium, and we're preparing the other one at our Academy of Music, The Art of Inclusion and Unification Through Music, and the other one is Music for Health and Well-being. So as you can see, we're working on many different levels how to use music as a form of social sustainability, because I do think that our future is encouraging us to use more of arts to make difference in our world. That's why I was saying at the beginning that we're coming back to our past. We're coming back actually to our origins, where music and sounds were used as a healing tool. And our question should be actually not how to get or create health and well-being through music. Our question should be how sound and music can help us to remain healthy, because all children who are in tune, who are aligned with themselves, they're harmonious. But our society, our environment is creating such I would say, disharmonious environment that we're actually changing healthy children to unhealthy adults. So let us promote actually sound and music as a preventive tool, how to not create mental health problems and remain healthy and inspire and enhance well-being. That's why we also created two interesting projects for children. One was a Behavior project, and here you can see one photo from this concert, who was created actually for babies and toddlers. And we wanted to inspire such a creative environment that with the sound and music and natural behavior of children, small children, which is crawling, which is bubbling, which is communicating in their own way, how they can be supported with quality music. So this was really something that was so inspiring for my soul. And the other project was in combination with Slovenian Philharmony in Ljubljana. And we did a project in family concerts, which is dedicated to children from 6 to 12 years old who come with their parents and grandparents. And the concert was called Music and Emotions. And we also combined in these concerts with Ozare, which is a society in association in Slovenia for mental health problems. So I'm very proud of the project that we are doing, because I'm very much sure that we have to use arts to make a difference in this world. So I would like to end with a quote of Slovenian composer Mari Kogoj, and he said, There is nothing more beautiful and perfect in nature than music. It directs a man into the depths of his soul. And I would like to add, we need soul in this world, and we need music and sound that would support us to come back to our soul, to stay in our soul, and to connect to connect our souls to get our world, to get this world a better place. So thank you for your attention.
Thank you. Thank you so much, Katrina, for giving us a new, fresh perspective about music, right from conception to gray, in different forms, vis-a-vis emotion and mental health. Katrina, you have beautifully explained the profound impact of music on mental well-being. I want to understand from your experience through the research and clinical work that you have been engaged into, that have you ever come across, I mean, what percentage of cases you have come across where individual experience significant healing only through music, just music alone, nothing else, not combined therapy? Or do you find that it is more effective when it is combined with other therapies or therapeutic approaches? What is your take on it?
My perspective on this is that it's it's always good to use a combination of everything, but I would like to emphasize that my doctoral student made a PhD thesis how we can use music therapy as intertwining between this physical and psychological effects. So, why is music therapy so effective? Because it works on both levels, not just on psychological level, but also on physical level. And we're now just applying for a Utopia project, Utopia Health, and we're gonna start using different methodologies. We're also gonna test how music therapy on neonatal ward can affect human genome. We're working this with Dr. Metka Raunik, who is a biochemist, and we're looking forward to see what benefits it's are gonna come. So music therapy is really very beneficial because it affects humans on different levels. Yeah.
Okay. So there's another question for you from Eleftheria. Eleftheria? Okay. So
Hi.
Eleftheria has, yeah, yeah,
Yes.
please ask. Yeah.
Hi, Katarina. Thank you so much for a beautiful presentation. And what also kind of comes to mind is also the sounds of nature and how that also really affects us. Like bird song, I know also really,
Yes.
calms the nervous system. And then also cats, what research have found is cats purring. If a cat is purring
Mhm.
on you, and your bones are, your bones can heal faster. I think it's 4 times faster, but don't quote me on that. So it's it's important to note that the humans also have our own song.
Sure. Uh, Music that comes from nature is the most healing music for ourselves. Yes. So I always say it's not just music. We have also be aware how to make a balance between music and sound and silence. And this silence is in nature. It's actually not silence, but it gives us our inner silence. So whenever I'm disconnected with myself, I go in the forest, I go to the seaside just to hear to these sounds of nature. Without this, we're nothing. And the most beautiful musical pieces get actually back to these sounds of nature. Yes.
Thank you. Thank you so much, Katrina. And in the comment section here, we got a question from Srishti Sharma. And her question is regarding with the relapse rate, high relapse rate, how to reduce the high relapse rate, specifically in depression and anxiety. And she has mentioned that she would love to know from both of you that what approaches have you found most effective in supporting long-term recovery and resilience. So this question is for all three of you. So I would
Okay.
like to start from Dr. Srinivasa Murthy.
I I would like to do that. Firstly, okay. Firstly, I want to say beautiful presentation by Ashish and Katarina. Thank you very much. And for example, one is music, you know, and to say parents, caregivers always find music to be the most important thing that they can do. The second one is I have put in the chat box this book cover. This is by a psychologist who is a musicologist who was on drugs for 20 years for bipolar, recovered, and she has 10 stories where different non-pharmacological methods have been used to recover. I have put it in the chat box, the details of the book. It's available in India for a very low price of about 400 rupees. Beautiful, excellent way people have presented their experiences.
Thank
My
you.
own personal feeling is that we have undermined the positive aspects of doing things naturally, exercise, sleep, nutrition, connectedness, music, spirituality. So, for the person who asked about it, I would say, in addition to pharmacological interventions, think of good lifestyle
Yes.
as part of your life, and you'll find it to be much better. Not only in anxiety, depression, even in schizophrenia, when exercise is introduced, they find that the person recover better and the prognosis is better. So my single advice is think of your hype, as Ashish said, totality, and make multiple interventions rather than depending on only one medicine or the other. Thank you very much. Ashish.
Yes, it's a. I'm totally agree with Murthy sir. Um, so I just come with the Srishti's question. Srishti asked that there is a there is a specifically that's a high relapse rate, specifically in a depression and anxiety. Yes, Srishti, we are. That's why we require the coach, or we require the someone who can guide or who can take care of and who can control your and who can guide the giving you the perfect path. So when you are taking a collaborative treatment, just like the music, then therapeutic treatments, as well as the medicines, home remedies, or correction of your lifestyle, there are the chances of relapse. It depends upon person to person how emotionally he's strong or not. So uh, that is the specialty of that coach, how he handle or how he guide or she guide for the that treatment. And definitely still the relapse is there, but there are the chances of cure is more, because you are connected with the someone, and when you are connected with the someone, at that time you are getting the good guidance also. So connection with the other person is the first remedy, and then after is the second remedy, just like the music. Yes, I'm using the music in my therapies also, a lot of musics, but definitely Katrina, I would like your specialty to involve in my therapies, because when we are doing the panchakarma therapies, we are utilizing all the bird sounds and the forest sound and sea sound and the different type of sounds. So I would like to connect with you after this meeting or maybe later on, and definitely we will work on this project.
Great,
Thank you.
thank you. Yeah. And maybe we could also talk about negative effects. We all always talk about positive effects of sound and music, but we have to be aware of negative effects. And because we are not aware that the sound environment actually affects us when we're not aware of it. We're subconsciously, our body gets everything that's around us and we react to it. So it's so important to be aware in what kind of environment we are in. We have to be we have to put in our life supportive environment in every level that you already mentioned, Murthy and Ashish. Yeah.
Yes,
If
there
I
is
can
the
come in for a,
sorry.
if I can come in very briefly, Srishti, about 5 years back, I talked to Schizophrenia Association in Pune, taking charge. What are the things you can do to prevent this one? I'll be happy if you can send me an email. I'll send you the write-up, which gives you very specific evidence-based methods of taking charge. I've just sent it to Rajni already just a few minutes back, but I'll send it to you, Srishti, and I'll be very happy if you send me any specific issue to respond to you. Just to add, I do only voluntary work, so you don't have to pay any money for me. I'll be happy to help you. Thank you.
Thank you, thank you, thank you so much, sir. And we have got another interesting question, which is very relevant in a contemporary society. That is the intervention of AI as a tool to help human healing, their mental health. So, are you currently doing any studies about AI and its relation with the mental health or something like that?
I would like to answer for this.
Please.
So basically, AI is the gatheration of the knowledge, and that is a tool which is collecting the knowledge from the which is already scattered in the network. So basically, till the time we are not that much advanced to connect this one with the mental health. But yeah, for the people who are dependent on the Google, so definitely AI they can utilize and they can get the number of sources and number of things in a basket. But after all, just like Katrina told earlier, there is the negative side of everything. Just like if we are not get know about the what is negative side and we are utilizing the thing, might be just like the decoction more than 3 months it can be registered to your body, so can be get a side effect. So particularly when utilizing the AI, we should put a prompt properly, then only we can get the correct answer.
Right, right,
Yeah.
right. And I mean, my own experience, especially in India, I have seen that all three systems of medication, of therapies, be it allopathy, Ayurvedic, homeopathy, and other secondary approaches like CBT, meditation, yoga, musical therapy, they definitely offer unique strength and they can complement one another effectively in addressing mental as well as other health issues. But I have generally seen, I mean, this is my experience. You might be possessing a different experience. I have seen often people, doctors, they criticize each other's system a lot. Generally, allopathic doctor, they do not like some Ayurvedic intervention or homeopathy intervention, and vice versa. It is both ways. So I want to understand, is there any possibility and practicality of integrating these approaches in a holistic way so that people could be benefited optimally? This is my question to
I would like to
You
answer
know,
this one.
yeah,
Yeah,
go
please,
ahead. Go
please,
ahead,
please,
Ashish.
Murthy sir.
No, you go ahead.
you.
So, so I'm telling you this time now the things are changing. Now, I'm an Ayurvedic practitioner, but still I'm manufacturing the nutraceuticals and the supplements for everyone. So diabetologist, gynecologist, orthopedic, neurosurgeons, and everyone, just like yoga practitioners. So customization of the particular medication and people literally this time, what I've seen in these 2 years, the doctors who are allopathy doctors also, when we was in that era before 5 years, 10 years, that the criticism was there. Now we cannot see that criticism because everyone accepted the truth after the COVID situation that anything can possible, the any disease can be reversed, and a lot of researches are going on that. And ultimately, the immunity is the main factor. Everyone understand. The lifestyle is main factor. Everyone understand. Now, when there is the work of allopathy medicines cannot be replaced by the Ayurvedic medicine. Ayurvedic medicines cannot be replaced by the allopathy medicines, where it's the requirement of that, the situation is like that, and you require that pathy. Surgery is required, then you cannot avoid it. Particularly in
Right.
the cancer situations, when you require the radiotherapy, then you require that one. You cannot
Absolutely. That
sustain
is
the
why I
allopathy.
use the word complementing each other. I didn't use the
Yes, yes,
word
yes.
replacing each other. Yes, please,
Yes,
Dr.
yes.
Murthy.
I want to take it a little further than that. I think we are reaching a level where we are recognizing not that they are complementary, contributory. Let me say one thing. For example, there is a paper which came out 1 week back where good sleep decreases the brain age by 5 years. Good sleep produced by Isha Foundation meditation, they found biologically, fMRI and other things. Similarly, I read a paper called Psychoneuroendocrine Theory of Suicide with 200 papers, 200 references, saying that what we used to think of stress and body different, now they are together. So you can, as Ashish would say, you can attack or you can correct from any angle and you will get the results. And the more number of angles you bring in, the more effective your interventions are. So we don't
Right.
have to think of either or, we think of all of them together.
Right, right, right.
I
And
am a
especially,
great,
yeah, especially, sir, here we have a practical example.
yeah,
Like we have seen, to increase the platelets, most of the
yeah,
doctors have
yeah,
accepted that papaya leaf extract in allopathy also. Now it is an accepted medicine. Actually, that comes from Ayurveda.
yeah, yeah.
So, yeah. Yeah,
But
thank you
there
so
is
much.
a one more medicine is there in a homeopathy, though I'm an Ayurvedic practitioner, but I am supporting homeopathy also, because for the I seen that results in a dengue patients, that overnight papaya is not working that much, but overnight the WBC increases, the platelet count is increases in several cases. That
Hmm,
the homeopathy is also working in certain cases very nicely.
hmm. I think
Just to
Dr.
give
Ashish, yeah, please carry on.
just to give one example, till about 1930, there was no drug available for treatment of hypertension. But Ayurveda has been using for 5,000 years Sarpagandha, which contains
Hmm,
reserpine, which was
hmm,
described by Dr. Vakil of Bombay as the
hmm,
first drug in 1930s. So there are
hmm.
so many things. I'm not saying everything is in India only. It could be so many areas. I think we have to be open, think of bringing in as many things as possible. And as Ashish said, choose the one which are culturally relevant to you. Whether it's the seasonal food, whether it's the ritual that you are used to it, you will get the best effect.
Right, right. Katrina, how would you like to reflect on it?
I just think that I'm so happy that we're living in time when everything is coming together. Because we were battling for our place so long. And now finally we reach the awareness how connecting is the source of future. Yeah,
Sure.
yeah.
Absolutely,
Yeah, so
absolutely.
I'm so grateful to be here and to be connected to all of you because everything is just intertwining. It's just like magic.
Absolutely, absolutely.
Yeah.
Right, right. So very interesting conversations we are having right now, and I request all participants to feel free to post their questions in the question and answer box anytime, because we have a few minutes for you in case you got any question. We have three doctors with us coming from different disciplines. So please let us know if you have any confusion, doubt, or you want to clarify anything. Of course, at the same time, I would request any participant who want personal advice to reach out to the doctors in person. That would be always preferable way, because we cannot take personal cases here during the session. But as Dr. Murthy also said that he is all there to help you out, and so you can definitely take advantage of doctor's expertise. Eleftheria, do we have any question right now in the QA box, or do you have any question for the doctors?
We don't have any questions at the moment. But I would just like to also express my gratitude. I think it's such a wonderful time that we are now able to bring multidisciplinary fields together and work together for each person individually. And I've loved this discussion so much. Thank you so much for your contribution for us to expand our awareness in mental health and know that we can be a participant in our own journey for mental health together with the community. That's very inspiring. Thank you.
Absolutely. And this was truly incredible, insightful, and impactful session. Very, very beneficial. And because this is something with which everybody can relate. And it's not like that you need to be necessarily having some mental issue. It's for everyone. We all want to be mentally healthy. So we should know how to manage our emotions. We should know when to seek help. So these conversations are very important, and a heartful thank you to all our esteemed speakers today, Dr. Srinivasa Murthy, Dr. Ashish Gaikwad, and Katarina Habe. And you're definitely, I appreciate your wisdom and knowledge that added immense value to today's conversation, today's session. And we also extend our gratitude to everyone who joined us, as participants for their questions, for their engagement, because your participation, your dialogue is very truly meaningful, which was aligned with the conversation, which made the conversation more deep and more useful. And for details on our upcoming events, please stay connected through our official websites as well as social media accounts. And definitely, once again, gratitude to all the speakers for your time, for your knowledge. And it's time to say bye. So thank you so much, everybody. Thank you, Eleftheria. Thank you, speakers. Thank you, doctors. And hope you have shared your numbers. Hope you have shared your contact addresses where people can reach out to you easily. And thank you so much. So please take care and bye.
Bye.
Bye.